Good afternoon to all our participants. We are starting our IPC Health webinar. This is the first of the webinar series that we are starting, and welcome all. I hand over to Dr. Renu Rawat, who is the head for content strategy for IPC Health IMPROVISE. Over to Dr. Renu Rawat. Dr. Renu Rawat, kindly unmute. Yes, thank you.
Welcome to IPC Health webinar series. I'll be your host for this session. I'll now invite our founder and CEO, Mr. Samir Sharif, to give opening remarks before we start the session. Over to you, Samir.
Great. Hi, everyone. My name is Samir Sharif. I'm the founder and CEO of IMPROVISE. I think most of you probably don't know who IMPROVISE is. We've been in business for 18 years in content and learning technologies. We've built platforms that power, hundreds of publishers around the world. Millions of users actually use our platform to learn and educate themselves. We work with some of the biggest global publishers like McGraw-Hill and Pearson, and we help them deliver content. We have over 700 employees, both in offices around the world, New York, London, Bangalore, Mangalore, and we have a really experienced executive team. We're really focused on medical content, and we have deep expertise in medical content. We work with some of the biggest brands in healthcare with content and learning. Some of the brands that you're probably very familiar with, from the American Heart Association to the Royal College of Nursing to Elsevier Science, Wolters Kluwer. So we work closely with them to help them move their content from print to digital, help them with digital learning, and doctors, nurses, medical students around the world use our technologies to actually learn. We've been wanting to do something in India for the last several years, and we saw the real lack of tool sets to help medical professionals with their learning. And that's when we started thinking about the idea about IPC Health. IPC Health was launched only in January, though we've been working on it for the last 2 years. And we've built a platform that is a learning management system, and a lot of the attendees today are using the system and is actually deployed in your hospitals. We started with just quality compliance training and induction training, but this is just the beginning. We are going to have a lot more features and content that's going to come over the remaining of this year and in the future. We're really excited. By the end of this year, we're going to be launching the Royal College of Nursing's certificate programs for nursing. We will also, at the beginning of next year, have the ACLS and BLS certification done through IPC Health. Plus, we're building a lot of tool sets to help both the hospital management and employees to really leverage the platform to really help its employees improve their delivery of care by improving their skills. In that, it's been fantastic. I mean, it's unfortunate that we are in the crisis that we are, but our platform, we wanted to use the platform to really disseminate information and educate. And in this regard, we've actually launched a resource center. I encourage everyone to come to the IPC Health COVID-19 Resource Center, where we have quite free courses around COVID-19, and we're doing update courses every 2 weeks. We also have blog posts, we have videos, we have materials from the WHO, CDC, as well as the Indian government. So really, the whole idea of IPC Health is to leverage our platform and disseminate information. And in less than 6 months, we have over 80+ hospitals using the platform, and 16,000 active users on the platform. So it's been a tremendous success, and I encourage all the people who are actually listening in to get in touch with us if your hospital doesn't have the platform, and if you do know other colleagues, recommend the benefits of the platform. So, you know, the whole idea with the platform is really improving the quality of healthcare delivery in India, really by spreading knowledge. I mean, knowledge is at the core of what everyone does. And we are, you know, at IMPROVISE, we are driven by the vision of integrating technology with knowledge so that we can actually improve the world and make the world a better place. So I want to now hand it over to Dr. Renu, who will start our first webinar. And it's really exciting for us. And we're going to see a lot more of these webinars. And we want people to tell us what you would like to see. And I want to thank Dr. Savita for actually, you know, initiating this. It's a big milestone for us at IMPROVISE to start this. You know, it's a, you know, and it feels very good. And I want to thank all the nurses and doctors out there who are, you know, our heroes in battling this crisis that we face. It's a pandemic that we've not faced in over a century. And it's really, you know, you're helping protecting us. So I want to just thank everyone. So Dr. Renu, do you want to go ahead?
Sure, Samir. Thank you. So good afternoon, everyone. As we are all aware that healthcare workers around the world are at the front line of the fight against COVID-19. They are working under tremendous stress and under limited resources. In the face of safe. Now, since healthcare workers are at the highest risk of infection, strict adherence to infection prevention becomes more and more critical. The fundamental principles of infection prevention control, they remain the same, and they are the strongest defense that we have today for protecting our patients, for our families, colleagues, and ourselves from acquiring this infection. Through this webinar on infection prevention and control protocols in the context of COVID-19, we'll try to address some practical challenges faced by healthcare workers today. So towards the end of the session, we'll be taking questions from the audience. And please note that you are on the audience, you are on the listen-only mode during this presentation, but you are still free to submit your questions. So what you can do is you can click on the Q&A button at the bottom of the screen and you can post your questions, and also please mention the name of your organization. And now I'd like to introduce our speaker, Dr. Savita Nagaraj. She's a professor and head of the Department of Microbiology at the prestigious St. John's Medical College and Hospitals. She's also the head of Infection Prevention and Control Unit and head of Quality and Services. She's also the Associate Medical Superintendent. As we all know that St. John's is one of the first responder hospital for COVID-19. They have actually set aside a 200-bed unit for treating COVID-19 patients. Dr. Nagaraj is part of the St. John's Task Force, which has been formed to deal with COVID-19. And she has over 20 years of experience. And in the past few months, she's been dealing with COVID-19 crisis, seeing patients and leading from the front. So welcome, Dr. Savita Nagaraj. Over to you now.
Good evening, all.
Good afternoon
to everyone. Can you hear me? Vinay, yes. Is it okay? Can you see the slides?
Yes, ma'am. We can see the slides. You may start. Thank you.
Yeah, thanks a lot. Thank you all for coming out this afternoon to listen to something on infection prevention. And I'm here to share information about our experience over the past few months regarding this tremendous stressful situation that all of us are in. And before I go through my slides, and I'm very thankful for IMPROVISE, Dr. Renu, and the others who've helped to put these things together so that we share what we are doing at St. John's as a first responder hospital. And it's my privilege also to be talking to a large group who have registered, who are there today to share my experiences about COVID-19. There is a lot of information that is already available on the website regarding this pandemic. So as the World Health Organization, the head of it, the World Health Organization said, we cannot say this loudly or clearly, enough or often enough, all countries can still change the course of this pandemic. So nobody is very sure about what is happening. We don't know. And we are in that state today. And it is not something that has progressively changed so that we have been prepared. It has happened all of a sudden. And that is the problem. All of a sudden, we have seen it happening in different countries. And then when it is at our doorstep, at our very own doorstep, is when there is state of panic. We do not know what to do, what to go forward with. So in this course of the lecture or today's topic, what I'm going to talk to you, the initial part of it is to just describe all that has been identified, known about coronavirus, nothing new, what is COVID, what its symptoms are, how does it spread, how can we contain it. So most of the discussion is in that. Then towards the end of it, I talk to you about what St. John's is doing. And towards the end, we want to discuss a few things about what is the way forward, because this is new normal. This is the way our life is going to be. It's just that before Jan 31st, when the world was declared that there is a pandemic happening, the life that we lived before that and the life that is going to happen afterwards. So there is a demarcation in how we are going to think, how we are going to live, and what we are going to do to survive. So this is what we are going to do today. And I hope to finish this so that we have some time for discussion and questions which are related to this topic. There is a lot about COVID that is already out on the web, on public domain. Kindly go through that. Anything else that with my help I'm able to address, we will look at it like that. So coronaviruses, as all of you know, are RNA viruses. They are a large family of viruses, and all of us have been affected by these viruses at some point or another during our life, sniffing, sneezing, and known cause of common cold and upper respiratory viral infections. It's been called corona because it appears like that under the electron microscope because of a crown-like appearance by the virus. This is about the virus. There is nothing different about this problem. What happened? What happened is the problem. We do know about SARS, which happened in 2003. And then we talk about MERS coronavirus, where animals got involved. And all of a sudden, in 2019, when the world was talking about, and your newspapers had little bit of information that there is something happening in China, so many cases, nobody paid much attention to it till it exploded and till it became everybody's problem that there is something happening outside this world. And we know what happened with SARS, and now we are dealing with COVID-19. So what exactly and why these names? So corona is a virus, COVID is the disease, so it's called as corona, VI is the virus and D is the disease, and 19 was the year of origin. Initially it was called as the Wuhan virus, but then because of issues of naming a particular state or a particular disease with the name for something as a virus, same thing happened with India with the New Delhi metallo-beta-lactamase. So it's changed and the terminologies also have changed. I think it is good for that reason, but you all are aware what is the stigmatization that has happened, what happened in China, what happened, and even here at home, if you read the newspapers, you see the stigmatization that is happening with this COVID-19. It's all happening because of various reasons, many things we could discuss, but for shortage of time, we will focus on what we know and what we could do about COVID-19. So it's a respiratory illness. It can spread from person to person. So that is the important information about the infection. And that is where the problem also happens. And that is where the problem also is amplified. So it's a new virus. So what do we might identify as new? In the corona part, you saw all those projections sticking out. Now those are the antigens. Now these antigens have become new. Our body does not know these new antigens, and therefore it is called as a novel coronavirus. Now this novel coronavirus has caused a lot of problems to us and to others because our immune system on which we survive day in and day out has no clue what this virus is. And therefore the virus can attack. And by the time it develops an immune system or an immune response, many people we find are dying. Some of them are seriously sick, but they are able to recover. And some of them don't have any signs and symptoms at all. So we know it's a respiratory infection. So there is transmission through breathing. And it was thought it was droplet initially. That means you cough, and therefore the particles with the virus flow out of your mouth in a fine spray and therefore can land up to 1 meter. And therefore the social distancing was thought that it is 1 meter or 3 feet away. And if you are aware, if you protect yourself, if you stay 3 feet away, you are careful not to get the infection. Then later they're talking about community spread. They talk about where there is aerosolization, where the droplets have become smaller and it can move more than 6 feet or even more than that. There's a lot of information also that if you talk loudly, and you also laugh, then these droplets are coming out. So these are all areas where research has come in over a period of time. Okay, so we do not know where we are, and we change our responses, we change what we are supposed to do over time, adding information to what we already know. And there is always a science behind it, but sometimes science does not always take the front line to our actions. So we also know that these droplets fall down on surfaces because they are large particles. The viruses are present. There is a lot of information how long these viruses stay. So currently it is keep yourself away so that you don't inhale. If you touch anything, kindly wash your hands. The mode of entry of these viruses, even through touch and contaminated particles, is your mucous membrane, your eye, nose, and mouth. And therefore the situation, don't touch your face, nose, and eyes with your hands. So symptoms, as any upper respiratory tract infection, tiredness, high fever, difficulty in breathing, dry cough, these are all things that people have found, but over time we are also seeing atypical manifestations of this particular disease. It is a respiratory virus. It's basically upper respiratory, but then when it goes down, it causes major problems. Now, why upper respiratory and lower respiratory? Because these viruses are capable of adding, or they hold on to the epithelial cells of the bronchial epithelium. So the symptoms can happen at any point in time, 2 days, 5 days, or even after 7 days of incubation, patients develop signs and symptoms, if they develop. And there have been a lot of situations where there are no signs and symptoms at all, but patients are known to carry the viruses. And that is where everybody is worried about now. Earlier it was travel from abroad. Then if you have cough, you have fever. Now it is even people who do not have any signs and symptoms carrying the infections. And those are where we have to worry about, and that is what we need to do. Now, atypical symptoms also through publications, through information, through the WhatsApp University, we get a lot of information that, okay, patients have just had cardiac problems, they've dropped dead, or they've had chickenpox-like lesions, the corona feet or the corona hands. So those kind of information, pain abdomen, diarrhea, or a direct delirium, weakness, and the patient has had and tested positive. Or what has also been seen that in the early stages, patients have loss of smell and taste also. So these are where we are as of now, not going into too much of detail into that, but to just tell you that over time, from the time of identification to when we are now, there has been a lot of change, and also the transition of the way patients present, the immune response of the patients, what happens, why some of them go into such severe complications, we do not know. So it spreads between people. Transmission is through respiratory droplets, possibility of spread when person touches the surface. So these are the areas where we have to protect ourselves. We protect ourselves so there is no spread through hand and contact. There is no spread through droplets. And also when we touch fomites, we have to be careful that we don't put those fingers which touch the fomites onto our face. So COVID spread, we all know that it is infection. We are worried about from whom we are going to get the infection, or how do we identify who has the infection. So infected people who have the virus may be symptomatic, may be asymptomatic. Now symptomatic conditions, yes, we will know because we can see, we can identify fever, we'll know that the patient has breathlessness, it is very objective. Asymptomatic is where we are worried about, and through the course of the lecture, this is where we are moving to what to do because of asymptomatic patients. We do not know. Even the person next to you may have the symptoms. And please understand that the signs and symptoms may develop 5 days earlier, 5 days later from the point of time the virus has entered into the body. So what happens during that exposure of the 5 days that had happened? And this is why the lockdown was initiated, so that we reduce this transmission. We also will have time to build up our healthcare system in case the lockdown and when it is opened up to deal with the surge of patients. So containing COVID infections based on whether it is symptomatic or it is asymptomatic. Now that is the crux of the problem, and that is where all things have now changed from regular hospital work. Regular hospital work, I'm talking about hospitals mainly because it's healthcare, and also people should understand even the community is where we are worried about. Anybody walking into a mall, etc., we find a mall, a cinema theater, classrooms will have this issue that anybody could be infected or carrying the virus in them. So we talk about isolation, we talk about constant monitoring, and before we go into anything else, I think a lot of credit should be given to the national government, the state government, for taking such rapid responses and taking the whole initiative that they are going to run the show. And there are a lot of the guidelines that have been laid. Hello? Somebody is talking to me? Okay, so there is a lot of guidelines that have been laid, which is easy for us for uniformity. They are taking a lot of pains to go out into the community, to put people into perspective, for them to identify. Sometimes it has to be done with an iron hand, and that is where the problems arise. They've also laid guidelines for the hospitals, a little difficult because these are things which a person would have never done earlier before January or before March. Getting people to get into that mode, you have to do this, stand in line, sit, stand, walk here, wash your hands, you know how difficult it is. And that is an area where we have to think what is going to happen and how we are going to deal with it. So isolation, constant monitoring, and also quarantine by the government. So they are doing a lot of contact tracing. The doubling rates are very important. If you've looked at today's paper, they talk about what we had as doubling rates of 3 days or 5 days is now become 10. It's now become 10 days, which was just a few days earlier, 12 days. Now this doubling rates is also very important for us to understand how fast the virus is moving in a particular community. There are people who've been called as super spreaders. Now these are people who have been identified or do not have any signs and symptoms, but the people who have come in contact with them have developed the infection or are carrying the virus. Contact tracing, which is streamlined by the government as of now, anything that comes to the hospital has to be, any patient, especially with upper respiratory, lower respiratory infections, which fit the criteria of suspect COVID or COVID, have to be informed to the government. Irrespective of whether the test comes positive or negative, they have to be informed. And there is a lot of information going on where labs have been sealed, hospitals have been sealed because this information has not gone through. We also should understand that we have a role in every part of this because it's not easy. It's not easy at all. And you can imagine with the government, with so many numbers of people and the densities of population in different areas, what kind of a trial this is going to be to all. So how do we protect all this? We know we wear a mask, we wash hands, we avoid contact with each other, we cover nose, and at best stay at home. That was still locked down. Now for economic reasons, we have to feed ourselves, we have to feed others, we have to take care, we have to venture out. Business has to happen. So what do we do? So in today's section, we are talking mainly of practical insights, most of which I've already spoken about, but we are going to talk a little bit on staffing shortage, a PPE shortage, when there is surge, what to do, how a hospital can be prepared in terms of resource planning, containment measures. Everybody has a role towards the community has a role towards what to the hospital that feeds the community. What should be the strategy for the hospital post-lockdown, which will happen officially? It is already working. I mean, it's a partial lockdown, but from 16th onwards, I'm sure this is going to be a total pre-lockdown era that we are going to be into now. So the guidelines from the Ministry of Health and Family Welfare, there are quite a lot of guidelines. What you do at home, what you do in the bus, what you do when you travel, if you want to go interstate travel, if you have problems or respiratory infections, where to go, whom to meet, They have given numbers. There is a lot of information that is happening. Lot of information, but some of those processes are not streamlined. People are still identifying what to do, how to do. Guidelines have been changed. Earlier you could go home. Now you cannot go home for home isolation. The government is taking care, because when home isolation and quarantine was given, people did not follow it because they were scared, because they did not know what was happening. They wanted to run away from that, and due to that there was a lot of community, that transmission happened between people in a household, in a community, in a cluster, in closed quarters. It has happened. So therefore the government had to be more strict. But we also know in the national scenario what is happening. We are slightly better off than our counterparts in Maharashtra, especially Mumbai, where there are a lot of problems that are happening. So how to protect healthcare workers, basically, whether it is your registration assistants, whether it's your security, whether the housekeeping, whether the doctors, nurses, your pharmacists, whether it is a radiologist, everybody comes under this purview, because we are prone, or we are at risk to develop these kinds of infections if we are not careful. It is not only COVID. We are at risk for developing any kinds of infections, but at that point in time, people did not think it was so much of a problem. For example, tuberculosis is still a problem. Influenza is still a problem. So many other kinds of infections are also a problem. The problem with COVID is that there is no treatment, there is no way forward, or there are no guidelines on what to do forward for the patient. And we are seeing a large number of deaths happening. And whether it was all because of COVID, whether it was actually happening, this is information that will come from the government as and when the information is available to them. So triaging is very important in the hospital entrance, how you move people, who are the people who are going to be in contact with them, how many people you arrange, how they are going to move into the OPD, how many of them meet the doctor, how they are going to stand in the pharmacy, how they are going to stand in the laboratory services, how they are going to wait for testing in the radiology department. I'm talking in a broad perspective that what all healthcare can offer. People who have small private clinics, private hospitals, definitely they will have a section for registration, a section for where people talk to them. Maybe the pharmacy, it's outside the building, but these are opportunities for risk where the person can get infected. I'm not only talking about the healthcare worker. The person or the patient who's coming into the hospital should understand that they are also going to be exposed to many other patients, and they are also going to be exposed to healthcare workers, and we are all human beings. So that should be taken in the right context by everybody, that minimum healthcare protective gear and disciplined use of that protective gear is very, very important. A triage area is who you're going to allow in, who you're going to decide has potential features where it could be symptomatic COVID. I'm also talking to you about asymptomatic and symptomatic, but in symptomatic, we think the viral load is going to be high and therefore the transmission is going to be high, right? So we are going to look at, as the lockdown progresses, how patients come, what happens, and that is what we have to build up on the way we protect people in the hospital. So focal people, triage, at least those words are something that you need to understand, and the government is very clear that there should be a fever clinic in the triage area, whether it is going into your ICU if you have an ICU, or if it is going into the ward, or he's just going to be observed for isolation for the 14 days that has been identified by the government that is important for people to be kept under isolation. We also are aware it is basically respiratory, it's fomite driven, so we have to take care for that. It's very easy to say do this and do that. If you don't have facilities for hand hygiene, if you don't provide something for respiratory hygiene, you are going to create problems, and also compliance from the staff and from the patients who are going to come in. Who are you going to triage? You have to have simple questions that even a security at the entrance will be able to talk, because we are talking now post-lockdown. If you have a hospital as big as mine, where there are around 3,000, 2,000 patients who come in every day, I can't have so many people who are going to man that particular area because there are not many people around. So we need to create competency. We need to create skill development for people to understand that a person standing there can actually do 2-3 things. which they were not doing earlier. So this is what is very important for us, a small checklist to understand who is it that comes in to the regular area and who goes into the others. And one of the very important decisions that were made by the government is that everybody wears a mask, whether it is a cloth mask, N95 mask, even a simple surgical homemade mask is very important for the reason which I spoke to you much earlier, saying that you find out that even by coughing loud, talking loud, sneezing, at least the transmission of droplets of 3 meters is going to come down. So that is very important for us. So the control of exposure at source, even if you have a well-ventilated room, if you have an AC environment, these are things that you have to take care, because with an AC environment, there are a lot of engineering controls that need to be made to take care of this particular infection. So we've spoken about this, so I'm not going to go through this again. It's just to tell you and reiterate again, distancing is important, hand hygiene is very important, avoid touching nose and mouth, practice respiratory hygiene, and staying at home. Now you have patients walking in, they don't know anything about what it is because they have not kept themselves up to date. So you explain to them, because if they don't understand, there is going to be a lot of problems. I'm not only talking about patients, I'm talking about healthcare workers also. We had patients who come in, we give them a mask, but they don't know how to wear a mask. So it starts from there. But how do you do it? You can't go and tie it for a patient who's symptomatic. So these are ways in which we have learned by experience and looking at situations, how we can take care and what are the risks that we could face. Personal protective equipment, testing of patients. Testing also, you know, it started with very few numbers, now it has escalated, but still we are not able to test all, and there are a lot of limitations for those testing. The testing also, we know that it may not pick up the virus in all of them because it may be in very small numbers. So if you say negative and actually the virus is in them, that is a situation also we should understand that is one of the lacunae for testing methods. Managing visitors and attendance is very important, because we know that any patient in the hospital is when the whole family will want to visit them. That is a complete no-no. And that is something which the patient will not understand. And also hospitals will find difficult to try to manage this crowd. Then infection control and environmental measures are also very important when we are talking about safety precautions. When we are talking about safety precautions and distancing, it also means your colleagues, your friends whom you laugh with, maybe the same hostel person you are going back to in your room. You have to have, say, social distancing between us, whether it is a meeting, whether we are meeting over coffee, anytime we have to have social distancing. People may forget, because once we are out of lockdown, it is like everything is back to normal. We need walkers, we need people who are going to supervise. So you need people to do a lot of other things where it was usually not done. Now we are talking so much, I'm talking, people are talking, but we need to move this information, what this platform Impulses is also trying to do, to create awareness among people, among different kinds of experts, etc., etc. Training also, you can't put everybody into a training group. You need to stagger the training. Then you have to do multiple sessions. For that, you need multiple people. Then training also, we know if you tell people in a lecture, there are few things only they will pick up. Demonstration will cut down your time of explaining things that needs to be done. Role plays will be very helpful to you. I'm from a medical college, so I can talk about skilling of the ICU nurses, using a skill lab, using mannequin. I'm talking to that level, but even whatever is available, I think there is a lot of importance that has to be given to demonstrate, to share, discuss. And it's important to include everyone in a particular environment about what is happening and what is the responsibility of each one, including patients and the others. Now, the precautions and safety measures that are available, since it's respiratory, you need to control the release of the respiratory secretions. You have different kinds of masks. People can afford and therefore are making masks. But since there is a directive also that the cloth masks need to be worn, it's very important. Cloth masks are reusable. They need to be washed, because if they are contaminated, they become or act like a fomite. So we have to be careful. If we are working as a team, we are talking to each other, it's very important to wear a mask. So there is a lot of memes going around, pictograms going around, saying that if there is a person within 3 feet of you, if he is infected, even if you wear a mask, the chances of transmission is possible. The transmission is less if the person who is extruding the viruses is given some kind of face shield or a mask. A mask is given to them. Cloth mask, face mask, anything. So the number of particles that each one of us is going to inhale is very less. If both of us are going to wear masks, that means an asymptomatic, a symptomatic, as well as healthcare provider, the transmission is going to be very, very less. And therefore, the decision by the government to use a cloth mask so that we are careful. Now, this is about mask. The mask, as you know, N95 is very uncomfortable. It may be very glamorous, very expensive. It is very difficult to use those masks because you can't drink water, you can't drink tea, or you can't go out for coffee because you have the mask. You need to wear it for the time that it is indicated. You have to wear it closely fitted to your nose, and that is where the problems start. It's easy to say I have N95 and walk around it with your hand, but it's not the way that it has to be used. PPE also has different other connotations, personal protective equipment, because of aerosol generating procedures, because we are talking of mucosa, you need to cover yourself up totally. And that is why these moon suits are there everywhere. Guidelines for use, the face shields, the goggles. If you even talk to people who are using it, you will understand it is so difficult to use this. Your dexterity has come down. Fine processes, procedures have come down. People can't communicate to each other. They don't identify who is in front of them because everybody is in a mask and this kind of a PPE. So communication and methods by which you will communicate to people within this PPE, put your name on that PPE or put it on the back of you so that people understand, okay, that this is the person I'm trying to communicate. Reuse of this PPE, availability of this PPE, how you're going to reuse it, how you make sure you're not going to contaminate yourself are all opportunities for training, awareness, etc. You cannot function long with these PPEs. So the shifts of people from 8 hours can come down to 6 hours, 4 hours. You've heard of people wearing diapers and doing this work. Now we're talking about surge versus normal. That means what was normal? Normal was what we lived earlier. Earlier in the sense, just around January, February to March when all these things started. Now it is going to be the new normal because predictions are there, and looking at the 1918 influenza virus, how it spread, how it killed people, and how long it took to move away from being a pandemic to a regular sporadic infection, took around 2 years. And that is how there is prediction that this is how this infection is also going to go, unless we get a very effective vaccine or very effective treatment. And we know that it is going to take time. And herd immunity also needs to be developed during that time. Earlier, travel was an issue, but any kind of travel now, because it is at our doorstep. You walk out, you walk in, you move in an auto, you move in a bus where there are crowds, you move in a train. Please understand that you are exposing yourself, you are exposing others also if we are not careful. Fomite contamination is going to happen a lot, and therefore the importance of social distancing, hand hygiene, and this is not rocket science. Social distancing, hand hygiene, respiratory care, awareness, treatment of patients who are symptomatic so they get isolated, reduced contact is very, very important. All easier said than done because it means change of behavior, change of attitude, which we are not used to at all. We have never been asked to do these things. We've never been told, do this and do that. There are people who have fallen into it, but there are major numbers who don't understand and who don't think that they need to do this. Safety versus surge versus safety, unlearn and relearn. This is where we are. We knew that this was what we were doing, but now we have to remove that and relearn. Tomorrow there may be new things that come up. We have to learn again. And this is the norm till we have a control of this particular virus across the world. We need to educate patients. You need to educate them in whatever possible way. You run slides, you display something, you have a session for the patients when they get admitted, even in the OPD, you have a counseling area where a person can talk to you, but at every point, kindly understand social distancing is important. that care loss will be felt from the patients. They will be feeling that we are stigmatizing them. They will feel that loss of that oneness, that closeness that healthcare workers had with patients. But it is something that you need to address to patients, otherwise they will not understand and there will be a lot of other issues. Now, long queues, they should have shelter. It is very hot now, provide water, and the water content, the purity of water is something that we need to take care. Hand wash is very important, cleaning of surfaces inside, outside. With the increased number of footfalls, with the increased number of contacts, your lift buttons, the panels on which patients may stand, talk, these need to be cleaned constantly. And protocols will tell you how they have to be cleaned. There is stress, and there is a lot of stress. And the way people project that stress, whether it is the hospital person, the healthcare worker who had to work continuously for 12 hours for the last 3 days, is tremendous. We need to understand that there has been a major paradigm shift in how things are appearing, how things we are dealing, and what we are doing with healthcare, even what is happening in the community. There will be violence. So to prevent that is where this communication is very, very important. Coming to triage area, again about the capacity of your hospitals, how many people you could get in, how many people you are able to move into these areas. What we said was triage or the fever clinics to identify potential symptomatic patients to reduce transmission. But there is also a pool of asymptomatic people which we need to take care, which could be addressed by those 3 important ways which we talk about: social distancing, respiratory etiquette, and hand hygiene, which is very important. Vulnerable groups are many. You cannot have a pregnant woman standing in this triage area or in the queue for a long time. Children, elderly, people who need immediate care, and that is what triage is also all about. You need to mobilize existing air workforces, especially which are not routinely attended. For example, the OPD timings may change. You need to start early because we have 1,500 footfalls in a day. We need to have OPDs early. We need to extend OPDs beyond waiting hours. People may have to be in the OPD for a longer period of time. So these are changes that need to be communicated to the workforce, need to be communicated to the patients. So this appointments, talking to patients, messaging them is very important in this time where all of us need to work together to make sure that what we were providing earlier as healthcare continues to do that. Entry restricted to patient and 1 attendant. That is very important. Again, easier said than done. Difficult in government institutions, difficult in areas that like our hospital for low socioeconomic, we have large number of crowds. And once the barriers between states are lifted, we are going to have going to have more people moving in because this was our catchment for our particular hospital. The security person can be trained if he is given proper PPE to measure the temperature, to flash the gun, and to identify, okay, this is a person with illness and therefore he can be triaged. So you have people in a particular place or in a particular time who can do more things than one, provided they are empowering them, providing you educate them, and therefore you can take this forward. But all this depends on how you're going to plan, how you're going to spend time planning. Please remember, this plan is not for the year. The plan is will be just for the next few days, because within the next few days, things will change. So it is dynamic. You need somebody to plan. You need a nodal person to give you the feedback. You need to change your plan. You need to add things, delete things, mobilize more people to certain areas, maybe remove people because the numbers are not so many there. So this constant mobilization takes a lot of supervision. Waiting areas are needed to be patrolled because we know that wherever there is large number of people, risk of transmission is very, very high. The housekeeping people need to be told that you need numbers at particular times of the day, mobilize those, and therefore it goes beyond planning. We have no room for being complacent, thinking that, okay, everybody is out on the roads, there is traffic jam, things are back to normal. I think we are going to see a lot of problems if we start behaving that way. Things where, areas where and conditions where we don't have to visit a hospital is teleconsults, then the laboratories, home collections, home delivery of drugs. Dedicated workforce, you have to understand that you know this is what you're going to get as patients, this is your workload. please mobilize workforce only for that. All hospitals are not COVID hospitals, but regular non-COVID work you will have to do. There are dedicated work hospitals and areas which the government has designated. I know there are issues for patients who will have to travel from one area to another hospital to reach that hospital. But this is the way forward, because small hospitals cannot cater to the requirements of looking after COVID, looking after the others. Please remember that anyone can be asymptomatic who comes to the institution. Therefore, the importance of standard precautions, etc., etc. Scaling up as what is happening in Mumbai, if you're looking at where they're using this Bandra Stadium to create more beds. They are making beds out of cardboard boxes. So that is how things are moving up, and it has to move up to a fast scale. Those things you can do, but where are you going to get trained people? So that is your planning, your upskilling, mannequin teaching, role plays, and actual nursing care is where we are going to have a lot of difficulty with. ICU care, ICU critical care, even otherwise where we need to mobilize training, competency building, and that is what is important. Machines like ventilators, people are providing, a lot of NGOs are providing. So therefore, hospitals which have been dedicated for that have been ramped up for all these items and requirements, so that when there is a surge, they will be able to handle. Certain hospitals have been dedicated only for this, and this information is available to all of us. I told you about shifts. You work for 7, then you take leave, because the 7 days or the 5 days is when people start developing signs and symptoms when they are working or exposed to patient care areas. It's important that PPE is also worn at all times by healthcare workers. People should not decide this is non-COVID and therefore I am okay just by doing what I was doing. Mental health is very important. If you look at all the doctors and nurses that have had bad outcomes because of COVID, because they have died, there are a lot of suicides also on those lists, because people have had to work long sessions or they were not clear what was happening. There was depression and suicides also. So this is the other part, or the darker picture, what is already there, but we need to understand that this is what is available to us, and this is what we have to look at in the way forward. Biomedical waste segregation information is very well defined, and the government is very strict on this. What we have to do and how we have to do, already hospitals are in that mode of how it has to be done. Only thing is that the care of these people, where they are supposed to throw this waste out, we have to train them, because they are wearing PPE. In many places, we know even to wear a mask or to wash their hands, they have problems. So if you are going to give them the responsibility, then you have to make sure that they do it. Constant monitoring is very important, because wearing the PPE is not important, but how you remove it without contaminating yourself is more important. So government rules are very strict, and we have to follow that. As I told you, home isolation was earlier allowed, but now it is not. Engineering controls are very, very important when we are looking at treating these kind of patients. Full ventilation, open air ventilation is very important in looking after especially respiratory tract infections. Discharge criteria also have been given by the government, which I am not going to much detail about. Material procurements, especially, it's easy to say wear PPE, but those who have been in the system of healthcare now understand that there are problems to procure this. There is a lot of materials that are available which are not the correct specifications. And as healthcare workers, we do not know what is it that has to be used. Is an N95? Yes, an N95. Is a 3-ply? Yes, a 3-ply. People give you 3 layers and they are telling you it is a 3-ply. Now, this is something that we have to take care of, because we do not know how these are getting in. There is no central quality for these kind, but when it reaches your institution, kindly make sure that what you release to your health force is at least what is recommended. So this is very important when we are talking about materials. Now, when we're looking at the worst case scenario, now why did I put this slide up is when I thought about it, and also this was the scenario that instigated most of the healthcare to start looking at a task force to look at, if there are so many numbers, how are we going to deal with it? And that is the credit also which has to be given to the government. which they looked at all these things and therefore started planning. So each government has been given that responsibility, but still we find that in certain parts of India, it is going a little way, much beyond what was anticipated. So hand hygiene, spreading, and these are requirements which are very important. Spreading awareness, already I've spoken to you. Please use logic, please use guidelines, and loads and loads of common sense. If I walk around, I find people wearing 3 kinds of masks, one over the other. So it's difficult to breathe. What are you going to do with those masks? So that kind of situations are where you have to explain to people, try to communicate to them that is not going to help you. Posters will help. Counseling is very important, but at safe distancing. You can teleconsult, you can talk to people, you have to demonstrate, you have to go out and find what people have understood. It's very difficult. It's very difficult. I explained, but I think we need to do it. And after lockdown, it's more work. It's more work, and it's been very, very stressful. And that is what we are going to face. In spite of having planned for the last 2 months and working every day, there is a different scenario. A little bit about St. John's, because we have been a focus on health and mission and health, that every life is important. Quality healthcare is very important even to the poorest of the poor. They should receive that. Every category is very important to us, and we need to take care of every category. The resource poor people we need to protect, especially in lockdown, unavailability, inappropriate PPE. This already I've gone back to you. So the criteria we started off with, and it changed with the ICMR guidelines, those who are symptomatic and those who are asymptomatic, and kindly look at them, and processes and flows have been given by the government, adopted for your institution. The task force which was developed at St. John's started with few, but you see the number of people that have been included. We are multi-speciality, so we have responsibility and resource people from all these areas, occupational health, whether it is to the community, whether it is even data entry. We have a nodal person who communicates and keeps updated with the government rules and responsibilities, guidelines. The top management, their important support, the nursing educators, heads of support services, whether it is housekeeping, engineering, the maintenance, pharmacy, purchase, who will update us about the PPE that is available to us, how we are going, what we have to do. So this is what we do in our task force. 9:15 every day we meet together. What are our guidelines? Now, when we started, it was only medicine dealing with fever, respiration. Then OBG came in, then people with radiology because of CT scans. So each section, each department is developing guidelines, and there are fora and their own organizations and disciplines which have their own guidelines. Now guidelines will come in, we need to integrate these guidelines. And that is where we have found our strength in St. John's. We have nursing college, we have a hospital, we have a medical college. We also have medical health administration. So research institutes, all these have their own skills. And we were able to build up a team with regulations, with apps, with educative materials, a medical education, a skill unit, which is one of the best in India. So we were able to build up and roll this out without much of a problem. So tomorrow, if I go back to think, how did we manage to do this? Then a lot of faces, a lot of people come together as this team, and this is how we've been functioning. And this is the need of the hour for any area that you think about. We also have the medical college who are not used to it, used to take patient care, but we were able to mobilize them to start looking at these activities. And also we were able to help the government through our community medicine department, and continued treating education, awareness has helped us to where we are today. Brainstorming is happening, what we have to do, where is our letters coming from, what is our guidelines, who's coming for investigations, who is coming for assessments. The government comes in between asking for a lot of information, but we are prepared. And I hope that we continue to be prepared to deliver what is needed. We have identified areas as per St. John's. There is a very good flow that is happening. There are very dedicated people moving towards it. I'm sure all hospitals have this. I'm just sharing you what we have been doing over the past few days. Isolation ward, a step down was not there earlier. Then we moved a step down. We had to mobilize forces. We had to mobilize treatment. and facilities, everything towards these areas. And we were able to look at it. So improvise, innovate, use logic, use science, use a lot of common sense. The government has helped us a lot with a lot of guidelines, and these are not guidelines for huge hospitals or multi-speciality big hospitals. They are actually down to earth, very important guidelines. Lot of hoarding is happening, but I think a lot of people are donating materials to all these hospitals. So we are moving forward. We are not so bad as how we are seeing other countries happening. So we have also stitched our own PPE. We have prepared our hand sanitizers. We have made it an effort, and day in and day out, there is a team looking for masks only from reputed firms. As of now, we are not reusing anything. We are trying to procure and make ourselves self-sufficient with a lot of inputs from different users and different teams, how we can improve way forward. Way forward, and this is what we have to do. There was a life, we lived a life. Now this is what we have to look forward to survive. We not only take care of ourselves, we have to look at who is around us. If people are not doing, we have to communicate. We have to take care of everyone around us, whether it is family, whether it is friend, whether it is the person next to us. We have to take care for ourselves and also for the others around us. I have a few disclaimers that I need to tell you, which I should have done in the beginning. I have no conflict of interest. I'm not going to take any support, nor have they been offered. And I don't endorse any of the things that are available on any platform. I was invited basically for my experience, and I accepted because of the platform and the extensive training that this platform, Impulses, has been giving to everyone in this time of need. Thank you for attending the webinar. And Dr. Renu, over to you, or Mr. Vinay, over to you. Hello?
Yes, ma'am, we can hear you. Thank you very much for the session. We'll take a few questions which are coming in live. I would request all our participants to please continue typing your questions, which we can read out based on the time availability. Over to Dr. Renu Rawat to read out the questions for Dr. Savita now.
Yeah, sure, Vinay. Thanks, Dr. Savita. This was a very informative session, and I'm sure that our audience would have got some very useful insights from this session that they would apply in their practice. So I'll start with the first question. What is the role of rapid antibody testing in controlling the spread? What is the interpretation of the test result?
Okay, now I think people should be aware that there is this antibody that is available. It's being tested outside. ICMR as of now has put a hold on these tests. So till they are basically mainly for surveillance. In terms of diagnosis, there are no clear guidelines. So we will wait for them till they arrive. They had bought kits and they realized that the kits were not up to the mark. So we are still in that phase. So also please understand that any test is only for that time, whether it is a real-time PCR or an antibody test. Nothing prevents the virus from infecting us at any point after that test. So this is where we have to be worried about that test is for that time. What happens a day after, once a person goes back, we don't know.
Thanks, Dr. Savita. There is a lot of confusion about herd immunity. So one of the questions from the audience is about the herd immunity. How important do you think it is in flattening the curve?
Herd immunity is, I think, it only means that there is a population who has been exposed and therefore they have the antibodies. Herd immunity is very important for any kind of infections, especially viral infections. Now, the problem with this particular virus, vaccination is also important when we are talking about herd immunity. Here we are going blindly in that people are infected. There is a lot of information also that the antibodies that are being produced may not be neutralizing antibodies and may not prevent reinfections. So we don't know where exactly this is going to help in flattening the curve. So the flattening the curve is where we look at the numbers are going to be stationary or it starts declining. Herd immunity is very important. But exposure to a particular infection and development of herd immunity, to what level, how long we may need to develop, that is still a question mark. But herd immunity is very important in protection and prevention of transmission.
Ma'am, one question from Dr. Mallikarjun. He would like to know, can we use 1% hypochlorite solution directly?
Directly for what, sir?
That he hasn't specified.
1% hypochlorite is only indicated for surfaces, fomites and surfaces. And if I have a laptop or a mobile, I don't use hypochlorite. I have to use alcohol. Hypochlorite is only for surfaces, for tables, for benches, for door handles, for lift knobs. There I use hypochlorite, sir, if he means directly. 1% can be used because 1% is what has been recommended for HIV, for any kind of infections. 1% has been used for fomites.
Dr. Savita, one more question related to this. How long does the coronavirus last on the subject like objects like surfaces and shoes?
Now these, there have been publications that on different kinds of fomites, for example, paper, when people are worried about patient discharge summaries, patient entries, like where the doctor enters the information, how long to do, what to do with that, especially in COVID areas. So we go by what has been explained by publications and information that is available in scientific literature, that it can vary depending upon the type of fomite. People talk about metals, people talk about paper, that it will be available, it will be alive for 7 days. Now the virus may be present, okay? The virus is present because most of these studies, please understand, have been to identify the genes. Now the virus may be there, it may be dead. The only way to know whether the virus is there and alive is to cultivate it, which these studies have not done. Maybe the studies are going on for this. There has also been information that when I'm coughing and I'm talking, the droplets are not going to selectively fall only on the laptops or on the surfaces. They will fall on the floor and you are going to stamp on it and you're going to move around. So drying is definitely important, but that doesn't mean you put it on a flame or you put it into a hot air oven. You also should understand where is the risk of these things for a particular patient. You touch your shoes, you wash your hands. No? So you're breaking the transmission by that. When we are looking at, do I wear shoe covers? Do I wear this? Do I wear that? I really don't know where we are going to take this forward. But if there is contact, if it is through your hands, please wash your hands. Don't touch your mucosa.
Okay, okay. Dr. Savita, one more question regarding infection prevention protocol. One of the audience, one of the delegate has asked that while somebody is under observation, what would be the infection prevention control to follow at home? So if somebody has been asked to self-quarantine, what would be the guidelines to take care at home?
It was there at home now, but now the government has changed that. If you look at the guidelines, that home quarantine, if it's only very mild symptoms, home quarantine is allowed. What happened was that whenever they found a person who was under home quarantine, they also found that the contacts of the person were also turned out to be positive. So currently it is that if there is a person who has been swabbed and tested positive, those kind of patients are now directly taken to government isolation facilities. So if there is, actually there is something called reverse quarantine also, which I will just say a few things. So home quarantine means that you have to segregate yourself in a particular one place where no person is going to come together. Your air conditioning should be out. People should not be within 6 feet of you. You cannot hug, you cannot touch, you cannot use the common surfaces. Even the food items that you are going to use, the cutlery that you use, if you are able to take care of yourself, you should be able to wash these things on your own. The surfaces have to be cleaned by yourself if you are able to take care of yourself. So a lot of implications are there, a lot of guidelines are there about home quarantine. It is not practical now to have everybody, but this is where the government has said that everybody who needs to be isolated should go to a separate facility for isolation. Home quarantine is not allowed, is the latest guideline that has come. Reverse isolation is very important. For example, you have elderly, you have the very young who are at lot of risk. Keep them away from you. Keep them away from you because they are at risk. if you are people who are going out, coming in from regular work, or even to the shop, or you're going to school, you're going to come, you have gone to an area where a lot of people are there, please come back home, take care of yourself, don't come in contact with these elderly and the children, and that is what is called as reverse quarantine. You are trying to protect them from getting infected from you.
Okay, okay. Dr. Savita, one question on plasma therapy. How effective is plasma therapy? The trials still going on in hospitals?
Yeah, trials are still going on, no, Dr. Renu, and I don't think this is the right platform to talk about it, because there have been issues where people have said it is good, where issues are there still, because the information has not come in, and where we look for this information is from ICMR trials or ICMR, where they have endorsed those trials and said this can be used. One-off people are using, but I cannot comment on that because I have no personal experience on it, so I don't know what to talk about. But there is a lot of information, credible information that is coming up. I think those who are interested to look at these sites, maybe your sites also will give them information regarding this.
Sure, sure.
Ma'am, one question from Anita Devnath. She would like to know, the combination of cloth and surgical mask is better than just surgical or cloth mask?
Okay, I've already in the course of this topic spoken about the importance of cloth mask. Now, if you're looking at there are different kinds, and I'm talking about the masks that are generally used. That is the N95 mask. We have the 3-ply mask already called the surgical mask, and the cloth mask. Now, the cloth mask has its own deficiencies or limitations. It is not capable of preventing transmission of viruses. Only thing is that when you wear a mask, it reduces the distance to which, if you sneeze, if you cough, or you talk loudly, the particles are not going to move out much from the mask, and it's contained within the mask. A surgical mask is important because it has filters, and it protects you when you are breathing from an area where you are exposed to, or the air that you are exposed to. And also when you are breathing out, it filters to a certain level so that the air the other person is breathing, because he is in contact with you, is also protected. The N95 is even more of a filtering device, because it sort of seals that area. When you look at the surgical mask, there are some vents from the side through which air can leak in. N95 is definitely there for different reasons. There's a term called as aerosol generating procedures. Now, these are fine droplets, very, very fine, less than 0.5 microns, where N95 is indicated, and it should be there. All healthcare workers, wherein there is an aerosol generating procedure, and all these guidelines are given very well, people have to follow that. Now, the N95 is for this reason. Now, cloth mask versus the surgical mask. Now, people have started using a surgical mask over the N95. There is a N95 which has a vent that is called an expiratory valve. Now, these have their own limitations, because when you breathe out, those valves don't filter the air, but it helps in easy breathing, and that is why it is called an N95 with an expiratory valve. Now, in those masks, you can wear a surgical mask over that. The other reason why people are wearing a surgical mask over an N95 is that when you touch a mask, you are contaminating the front of the mask. So the N95 is precious commodity now. So to save an N95 mask, because of extended use, prolonged use guidelines that CDC gives, people are touching the surgical mask, which can be discarded. Now, the question is surgical mask over the cloth mask. Now, that kind of a thing, I do not know. I do not know, because I told you in the morning, I found somebody wearing 3 layers of masks. Now, these are areas where we have to talk to people about, especially in resource poor areas where a surgical mask is definitely important, and guidelines are also available that people who are in contact with patients' non-aerosol generating procedures should wear a surgical mask, and those numbers are falling down very short. People who don't have that contact can wear cloth masks when you are outside. The admin staff, all of them can wear cloth masks in a hospital environment. So I don't know how much I've told you, but some of these practices, as I told you earlier itself, it is fear, it is paranoia, giving rise to all these kind of unscientific protocols and attitudes and behaviors, doctor.
Yeah, Dr. Savita, and I think take 3 more questions. We don't have that much time. So one is that is orofecal route possible for as a mode of transmission?
The virus is a virus which is capable of, like all other coronaviruses, even influenza virus, they attach to the epithelial lining of the intestine. When I spoke to you about abnormal symptoms or atypical symptoms, severe pain abdomen with loose stools have also been documented. And these standard precautions, whatever, whether COVID or non-COVID, talk to you about wearing these gloves and also using diapers or making sure that you don't handle with bare hands. And the fecal matter, whether it's in a diaper, the recent biomedical guidelines tell you if there is a bedpan where fecal matter is collected, it has to be flushed with 1% sodium hypo. So these are the guidelines that are available. Now, beyond this, when we are taking care, actually people were talking about you close the lid when you're flushing a toilet. Then if these toilets also come into an AC environment, then the aerosols will be generated more. But we still do not know, because from the aerosols or from the air, whether these viruses are there, what level, we do not know still. But the viruses can be transmitted through not about feco-oral so much, but definitely they are excreted in the feces. Now, oral is that you don't wash your hands, definitely you're contaminating yourself, you're contaminating whatever the fomites you're touching. So hand wash is very important, especially after using the toilets, which most people do not do. So there is a lot of attitude change, behavior change, provision of materials, whether it is at home, whether it is in public areas or in the healthcare environment.
Okay. So we have one question regarding the use of, so should ACs be switched off in OPDs, even though it's a non-COVID center?
See, what people, or there are a lot of guidelines regarding engineering controls in the OPD, in the OT, in the ICU, where they talk more about air exchanges. Air exchanges means that the air has to move in more frequently. Now, when we are talking about ACs also, what is the scope of infection transmission? For example, if you have an AC with an OPD where there are aerosol generating procedures that can happen in a particular area, it is wise to switch off the AC in those areas. Open the windows out. But if there is other things that are happening which should not happen in that particular area, you may have to shift it to areas where these can be taken care of commonly. If windows are available, kindly open those windows, let in fresh air. Air exchanges, air handling, HVAC systems, there are lot of information is available in the public domain. A lot of experts have given a lot of webinars about how to use AC. Switching off means just not switching off. You have to ventilate the air out. How will you ventilate it out? Open out the doors and windows. If there is an aerosol generating procedure, either you close the room for about 20 minutes, making sure that there is air exchanges happening, and then take in the next patient for the next aerosol generating procedure. The AC is because of this, whether it is central air handling or whether it is your window AC or split ACs.
Okay. Dr. Savita, one last question. What message would you like to give to nurses to be mentally strong in this time of crisis?
Yeah. And especially when they are looking at people who are, and all these videos were circulated and we thought, okay, it's happening on the other side of the sea and it would not affect us. But when we see the same thing happening in different parts of India, especially in Mumbai, and so much of information we do not know. A lot of people are falling victim to this condition, the young, the old, and definitely the nurse. The nurses are the main because they are directly in contact. And there is a lot of stress, which I have been emphasizing on. We have a psychiatric department which is helping out in this kind of counseling. Even they are training others how to counsel, so that any person who is coming in contact needs counseling. Counseling also for healthcare people. Somebody has to motivate them. And also what is important is the employers or the people who are above the nursing staff, they should also take care of them for their requirements, their shifts, the lengths of their shift, their exposures, the risk of exposure. the maximum PPE should be given to them. Maximum PPE for the work that they are doing. Because they are the people who are in direct contact. Please remember, contact also means for the duration you are in contact. If you are in contact with 10-15 minutes, your risk is definitely less than compared to a nurse who's going to be in the same environment for 8 hours in a day. You may have to change your shifts. You may have to change it to less than 4 hours. So resilience is very important, and nurses by themselves are tough, and hats off to this whole group of nursing people, whether it is from ours or anywhere. They are doing a tremendous job. Healthcare, especially, not only healthcare, even if you look at the policemen outside, everybody is working towards it. And I think small things like social distancing, hand hygiene, and wearing a mask and respiratory etiquette is not too much to ask from every one of us, whether we are on the road, whether we are traveling in a bus, or we have come to a hospital, or we are at home.
Okay. Thank you, Dr. Savita. Though we have many more people from the audience, but in the interest of time, we have to conclude the session now. So
Yeah.
I would like to thank, Dr. Savita, I would like to thank you on behalf of IPC Health for taking out time to share your experience. And let me end by saying that no one can discount the risk of getting infected when you're working in such close quarters with COVID-19, but with the right precautions, it is preventable. On this note, I would like to thank you all for your participation.
Yeah, thank you all.
And
Renu, continue.
No, I'm just saying that recording of this webinar will be available on our website, IPC.in, from tomorrow afternoon onwards.
I know there are a lot of questions which people ask, because this information is already available. So I think there are platforms where these things can be addressed, and maybe you could look at things again at a different time with different perspectives, where all these things can be addressed to people again. Thank you all for the opportunity, and also thank you for all the back-end help. It went very smoothly, I hope, because I was like just talking without knowing what was happening on the other side. I hope it went very smoothly. Thank you for your IT support, my IT support. Thank everyone for the time. Kindly be aware, this is not going to end anywhere in the near future. Please take care of yourselves, take care of everyone around you, and stay safe. Thank you all, and thank you very much.
Thank you, Dr. Savita. And there's also a feedback form that we would like to you to fill and giving your suggestions. Thank you.
Thank you, everybody. We'll be closing this session. Thank you for all the participants who were able to join for this session. Thank you.